Dr. Duffy, people with HD will have problems with their blood pressure and tend to have higher heart rate.
This is a complicated statement, and I'm sure you have some input into this as well. So, in general, we do not think about Huntington's disease as a blood pressure or heart rate problem. It's not directly related to cardiac health. All right. When I think about someone who's symptomatic with Huntington's disease, they're not at a higher disposition per se for blood pressure and heart rate problems. It's not something that we tend to see. All right. In general, you tend to actually see people with symptomatic Huntington's disease with kind of lower blood pressures for lots of different reasons. Now, we have this nervous system called the autonomic nervous system. And that's a thing that works in the background that when we stand up, our blood pressure pops up so that our brain gets blood and we can move about our day. So things that we don't really think about that autonomically or autonomic, it's autonomic and autonomic are happening in the background, right? It's just we don't think about it. Automatic. There we go. So that there's changes inherent in that process with neurodegenerative processes, whether that's Huntington's disease or Parkinson's disease or other neurodegenerative diseases, but not a direct correlation. But people tend to be lower weight with Huntington's disease, which means that their blood pressure is lower. They tend to have less often other medical problems. They tend to be otherwise fairly healthy in a lot of ways, other than Huntington's disease. So blood pressure tends not to be an issue unless there's low weight, poor food intake, and then their blood pressures actually run on the lower side. And then heart rates with lower blood pressures, as well as movements and any other like anxiety, other things going on, the heart rate can be a little bit higher, but usually not clinically significant. Now, there's changes that people see pre-symptomatically. That's a separate issue, but this is really what we see. That being said, we tend to blame everything on Huntington's disease once it's there. And people tend not to take care of their general health otherwise. So, checking in with their primary care and having those annual appointments that we all have to go through to make sure that our blood pressure and our cholesterol and our sugar levels are fine. And so it might be years, and then someone goes and gets checked out, and things are all out of whack because we've ignored everything because Huntington's disease takes the front seat. So we always make sure that when we're checking in with people about how they're doing in general, is are you checking with your PCP? Have you had your normal blood work done? All your other body systems checked out? Because overall global physical health interplays with our brain and our overall longevity. And we want to make sure that we're taking care of all of our other body parts while also tending to Huntington's disease. So while not directly correlated, we still have to pay attention to it.
I love that the HD clinic, because I'd go into the HD clinic and like you guys were like my marriage counselors. And I remember Dr. Wheelock saying, Katie, you need to see like a marriage counselor or something. And I'm like, no, you're supposed to fix it. You're supposed to fix everything. You're our HD neurologist. And there's some things that I'm not going to fix, Katie.
Right? You're like, that's not my body part. I haven't dealt with that in a long time.
Yeah, exactly. I was like, oh my gosh. So yes, we do lean a lot on you guys for everything. That is for sure. Dr. Napolis, we keep hearing about long placebo groups and upcoming trials. If the trial is successful and it is granted accelerated approval, will that placebo group be able to get on the therapy right away, or do they, through the accelerated use, or do they have to stay in the placebo group?
So if that happy day comes along, then absolutely. So if there is a point in the clinical trial in which there is a decision made about, and this could come at the end, but it can also come in the middle. And I think everyone will relate to what we already know, which is what happened with the previous trials with tominersen and the WAVE, is that they stopped early. And they stopped early because they found that it wasn't working or that in one group was getting worse. And so there's a safety monitoring board. And so there is an external group that's always reviewing the outcomes of the study in order to make sure that ethically we're not exposing people or not exposing them or providing them or getting in the way of an opportunity for benefit. So what I mean is that if halfway through the trial it looks like the drug is not good and you might get worse, they're going to stop it. If halfway through the trial they find out, oh, this drug is working, they will stop it and make sure the people that are on the placebo group will get it, right? Because they can't, if there is that case, right, it happens both ways. If they
Right.
stop in the middle and say, oh, everyone off this drug, it's not working or it's making things worse. But it's the opposite is true too. And there's many examples of this. If you have a clinical trial and in the middle, you don't wait till the end, but in the middle, if it's really clear, oh, this drug is working, that means the people in the placebo group, unethically, you can't keep them on if you know that drug works. So that's something that happens in the middle. What the question also refers to is at the end, if there is accelerated acceptance, then yeah, you would get it. But also too, you probably wouldn't have to wait for FDA approval. If you're in a clinical trial, you get to the end and the endpoint is made, it's often the case that the people who are currently in it on the placebo will then be able to be placed on the medication. And so I think the most important thing is that the concept of ethical treatment of the placebo group is carefully evaluated. And keeping somebody on a placebo group too long is part of the process where we don't want to cross that bridge. Now, having said that, the biggest issue, we know this, the biggest issue with our gene therapy trials is that we have to show lack of progression. And because Huntington's disease is so slowly progressive, then sometimes it may take 2 years for us to know the answer. That's the problem scientifically, right? It's one of the reasons why I say if we look at JHD patients, we'll know the answer quicker because they progress quicker. But all of the studies are not only looking at adults who have a slow progression, the studies are now starting to look even earlier, right? They're starting to look at people who are maybe even pre-symptomatically. So once again, that study, in order to prove scientifically that drug is helpful, needs often at least 2 years. And yes, that's a long time for it to be in a placebo group, but it's also because of the disease, that's the time frame that clinical trial needs to go for in order to determine whether that drug is helpful or not.
Thank you so much. I think that everyone is just watching this Votoplam, right? And they're like seeing this placebo group, and people are getting really educated about clinical trials now. You know what I mean? Where we would just openly go, and now we're looking at placebo length, cross extended, open label. Like now we know all this stuff, which is so cool that our community is so savvy and so smart, but it makes them stop and question, okay, now I'm going to be in this placebo group for 3 years. And then I may now not be eligible for another trial because I wait for 3 years. And am I willing to do this? And them asking these questions and self-advocating is awesome.
All great questions, all
Yeah.
relevant questions.
Yeah. Oh, Katrina, you're muted. I was like, she is talking.
Sorry. Dr. Duffy, people with HD will always experience dementia-like symptoms at the end of their life.
Yeah, so there are certain things that are predictable with Huntington's disease, so it feels like most and many things are not. And there are some things that are truly unpredictable with Huntington's disease. Memory and motor decline, we know that we can track over time. And we know that every year there's a gradual decline in cognitive or memory changes and what we call motor or physical changes over time. And we can quantify those to certain degrees based on longitudinal studies or long studies that have looked at disease over many years. And so we can predict that people will develop physical and thinking or memory decline over time. And yes, dementia becomes very much a part of the disease. And as the disease progresses, it becomes more prominent and takes over, unfortunately. And our loved ones do get lost into the disease, as we see when the cognition really takes over. So quite predictably, that will be part of the HD journey. Now, it's When I think about neurodegenerative diseases, I think about spectrum diseases. Everything is on the spectrum, where just because you met one person with Huntington's disease means you met one person with Huntington's disease, and everybody has a different journey, and they get to define their journey and go about their journey as they individually choose to do and as the disease allows them to do. And it's hard when you come from an HD family not to look at mom or dad or aunt or cousins and to say, this is my fate. This is about what I'm going to embark on. And no, just because your mama had that journey does not mean that is yours. You are a different human. You go about life differently. You feel differently and you make different decisions. And so this disease and this journey is going to be your own. But we know that there is going to be impact of cognition and motor on that journey. Now, mood and behavior is the most unpredictable part of this journey. Some people have very impactful, very extreme mood and behavior changes. That is not the predictable piece of it. But yes, this question specifically asks us about dementia and cognition, and that will be part of the journey.